Let's get started. First of all, we are going to discuss firstly the alcohol-induced lacerations. Then we are going to discuss about the some cancers of the esophagus. So let's get into it. First of all, is the alcohol-induced lacerations. It means that due to drinking of chronic alcohol, there are lacerations or lacerations in the walls of the esophagus arises, and there are two kinds of lacerations we can see. There are diseases basically. First is the Mallory Weiss tear and second is the Boerhaave syndrome. Mallory Weiss tear and Boerhaave syndrome are like opposite to each other. So first is the Mallory Weiss tear. Why I have written like these alphabets separately? There is a reason to that. First is the M, right? So M means that the tear is going to occur in the mucosal layer of the esophagus. Okay, it's a superficial tear. It does not crosses the submucosa, muscularis mucosa, and serosa. It's not going to cross that, right? So it is going to occur in the mucosal layer. It's a superficial tear. Second is the AL. AL means that it's due to the alcohol consumption, as we are discussing alcohol-induced lacerations, right? Lorry. Low means indicating two things. First, the tear is longitudinal. Okay, the tear is longitudinal, and low also means that it is lower to the gastroesophageal junction. It is below the gastroesophageal junction. It's going to occur in the cardiac area of the stomach, right? As you know that this is the cardiac area and this is the like body of the stomach. And the symptoms for the Mallory Weiss tear is that vomiting blood. There is blood in the vomiting. We call it as hematemesis. So let's revise it. Mallory Weiss tear or Mallory Weiss syndrome is the superficial tear occurring in the mucosal layer of the esophagus. It's due to the excessive alcohol consumption, and it is longitudinal tear and occurring in lower to the gastroesophageal junction, and the symptoms includes hematemesis. Moving onward is the Boerhaave syndrome. The Mallory Weiss was a superficial tear, right? So Boerhaave will be opposite, it's transmural. Transmural means that it's a full thickness tear. It's going to occur in the all layers, all histological layers of the esophagus. And the Mallory Weiss was below the gastroesophageal junction. Boerhaave is 2.5 centimeter above the gastroesophageal junction, and both have hematemesis. They have vomiting with blood, but the Boerhaave syndrome also presents with the Mechler's triad. Mechler's triad is a very famous triad used in the pathology. It's chest pain. It's presenting with chest pain. There is pain in the chest, vomiting. Okay, so we can say that there is painful hematemesis because there is chest pain and there is vomiting with the blood. So there is painful hematemesis. And the third is the subcutaneous emphysema. Why is that so? Because there is tear in the esophageal walls, so air passes through that and air enters the mediastinum, right? So it presents like emphysema. So we hear Hammond's crunch sound on auscultation. When we auscultate that area, we are going to hear Hammond's crunch sound. It is very typical for the subcutaneous emphysema, and it is due to the air present in the mediastinum. We call it as the pneumomediastinum. Okay, and we are talking about painful hematemesis, right? There is pain when we vomit, but if there is pain, less vomiting, but there is vomiting and with the blood, but there is no pain. So we are going to think another disease known as the rupture of esophageal varices. Varices are the veins or enlarged vein around the esophagus, and they become enlarged due to the portal hypertension and they rupture. So the fresh blood passes from those veins into the esophagus and mixing with the vomit, and there is pain, less hematemesis, okay. And painless vomiting can also occur in case of gastrointestinal bleeding. When there is bleeding in the GIT, so the patient will going to present with the painless hematemesis. This was for the Boerhaave syndrome. The next disease, very famous disease of all the time, is the Barrett's esophagus, and it's very important clinically. Barrett's esophagus is a type of metaplasia. What is metaplasia? Metaplasia means that conversion of one cell type to the other cell type. For example, squamous is changing into columnar, columnar is changing to squamous or cuboidal, etc. In this condition, the normal epithelium for esophagus is squamous epithelium. But we have discussed in the previous lecture that due to GERD, what is GERD? GERD is the gastroesophageal reflux disease. It means that from the stomach there is acidic reflux going into the esophagus. So due to the GERD, due to the reflux, due to acidic reflux, the e- esophagus epithelium will going to metaplace into something other epithelium. It's the intestinal columnar epithelium. And the word columnar is as important as the word intestinal, because the most important thing here to remember in the Barrett's esophagus is that the squamous cell changes into columnar epithelium, but these columnar epitheliums are resembling the intestinal epithelium. They will going to have the goblet cells, and goblet cells is a very important histological mark that we are going to identify the Barrett's esophagus. And goblet cells are not empty. They have mucin, okay, they have mucin, but which kind of mucin? Do they have basic or acidic mucin? They have acidic mucin. And this is some extra edge for the students that acidic mucin is stained by a special stain known as the Alcian blue. Alcian blue is a stain that is going to stain the acidic mucin of the goblet cell. So it will help us to identify the Barrett's esophagus histologically, right? Symptoms include that heartburn, pyrosis, and regurgitation due to the acid reflux. It is due to the GERD, gastroesophageal reflux disease. The stomach content or the stomach or acid is going to regurgitate into the esophagus, so the person presents you with the heartburn and regurgitation. What will the endoscopy reveal? Endoscopy will reveal red velvety area or salmon colored area, okay. And when the endoscopic surgeons identify that this area is 3 centimeters more, it is the large segment, and if it is less than 3 centimeters, it is called as the short segment. This is the normal esophagus, as you all see that it's a like pale pink color, right? Pale pink color. But in case of Barrett's, it will have a red velvety area as indicating in this diagram. Histologically, what was the hallmark for Barrett's? It's the goblet cells, right? Intestinal columnar epithelium. It will going to have these empty cells. These are presenting as empty, but they have acidic mucin, right? And acidic mucin was staining with which stain? Alcian blue. And they also have glandular metaplasia because the goblet cells are also presenting with the glands, okay. I will show you that why I'm talking about the glandular metaplasia in case of the Barrett's esophagus, because there are several glands that are present histologically, so we also call this metaplasia as the glandular metaplasia. And is there any blue stain here? Yes, we are seeing the blue Alcian blue stain, which is staining the acidic mucin of the goblet cells, right? Metaplasia is okay. It is converted to dysplasia, and dysplasia is a precancerous condition. Dysplasia of the esophagus converts it into the carcinoma, and we are worried when the Barrett's esophagus changes into a carcinoma, and we can say that Barrett's esophagus is a pre-malignant condition, and this is very dangerous for the patients, right? So which kind of cancer will going to arise from the Barrett's esophagus? Is it a squamous cell carcinoma? Is it adenocarcinoma? It is adenocarcinoma because adeno word indicates glands. Okay, as I have told you that why we call this as a glandular metaplasia, because from this esophagus, from the Barrett's esophagus, adenocarcinoma will going to arise. Squamous cell carcinoma will not going to arise from the Barrett's. And there is a special terminology used to classify the dysplasia. Just remember the names. You don't need to remember the all classification for that. It's Riedel and Viana classification to classify the dysplasias. As we're discussing about the precancerous or pre-malignant condition, so let's talk about the esophageal tumors. First is the benign and the second is the malignant. Benign also only have one tumor or one cancer or one benign condition. It's known as the leiomyoma. What does the term leiomyoma means? It means that the tumor arising in the smooth muscles of the esophagus. And among the benign tumors, it's the most common form of the tumors in the esophagus. And we are not going to discuss in detail about leiomyomas, but we are going to discuss about the malignant conditions. As far as malignancy is concerned, we are going to divide the esophagus into three parts, into one third, upper one third, middle one third, and the lower one third. The lower one third will have adenocarcinoma. What is the logic behind this? It is that gastroesophageal reflux disease, the stomach acid will going to regurgitate into the lower part of the esophagus, and this part will going to undergo Barrett's metaplasia, right? And from the Barrett's, we have discussed that from Barrett's esophagus, adenocarcinoma will going to arise because it's a glandular metaplasia. And in the upper and the middle one third, squamous cell carcinoma will going to arise. So let's talk about squamous cell carcinoma. Firstly, squamous cell carcinoma risk factors. It's very important to remember the risk factors for these two carcinomas because clinically the patient will going to have some of the history related to these risk factors. First is the alcohol, and along with the alcohol comes the smoking and hot beverages, right? The fourth is celiac disease. Celiac disease we're going to discuss later that it's due to the gluten sensitivity or intolerance. The patient's digestive system is intolerable to the gluten. They have gluten sensitivity, so the celiac disease is going to arise, and this is also causing the squamous cell carcinoma. Drug toxicity, also radiations, chemotherapy can come along that. Epidermolysis bullosa, it's a condition of the skin in which the skin became fragile. The skin elasticity is reduced. It means that the skin is more prone to breakage, right? And the fermented milk, you can remember it if you want that in the Kenya as like a tradition, there was a milk, a fermented milk known as mursik was presented to the people, but later on they found out that this was causing the esophageal cancer, squamous cell carcinoma, right? Next one is the human papilloma virus. Human papilloma virus, from head to toe, it will going to attack the squamous cells. Okay, because the normal esophageal epithelium is squamous cell. Okay, squamous cell epithelium. So human papilloma virus will attack the squamous cell. Either it is present in the oral cavity, the cervix, the anal canal, the esophagus. It will going to attack the squamous cell. So HPV. Next is the a very fancy disease, tylosis Palmaris et plantaris. It's also known as the Howell-Evans syndrome. Tylosis palmaris et plantaris means that there is thickening and yellowish appearance of the skin of palms and feet, right? So palms and feet will going to present with thickening and the yellowish skin. It is due to the hyperkeratosis. You can also say that this disease is like a representation of the hyperkeratosis. We're going to discuss that in later lectures. Then is the Plummer-Vinson syndrome. We are going to discuss it in detail. And the last is the genetic mutation known as the SOX2 mutation. SOX2 is a gene that codes for transcription factors, and these transcription factors have responsibility to maintain the embryogenic stem cell population. But when there is SOX2 mutation, the gene coding for transcription factor is mutated, and this will lead to the squamous cell carcinoma. Plummer-Vinson syndrome. Okay, one of the risk factors for the squamous cell carcinoma we are going to discuss here. Plummer-Vinson syndrome, also known as the Patterson-Brown-Cali syndrome. Patterson-Brown-Cali syndrome, it's named after like scientist or biologist, but this name is not going to tell us anything about the Plummer-Vinson. But there is an other name. The biological name for this syndrome is sideropenic dysphagia. Sidro means iron, penic means deficiency, dysphagia means that there is difficulty in swallowing contents, right? So this syndrome is going to present us with a triad. Triad have dysphagia as the name suggests. Sideropenic means iron deficiency, anemia will also be included in the triad. And the third thing is the esophageal web. Esophageal web are the thin membranous structures that are formed inside the esophagus. As you can see here that there are like ingrown structures that block the esophagus. They are like webs. We call it esophageal web. This is also the reason for the development of Plummer-Vinson syndrome, and the Plummer-Vinson syndrome is a risk factor for the squamous cell carcinoma. The patient, maybe the history can be presented as the middle-aged female. The examiners will not give you all the things in a platter, but you have to identify the things by your own in that context written in front of you. Can also be present with glossitis and cheilitis. Glossitis means inflammation of the tongue, and cheilitis means the chapped lips or dry lips. So Plummer-Vinson syndrome, they have iron deficiency, anemia, dysphagia, and esophageal web. Okay. What are the risk factors for adenocarcinoma? Most famous is the Barrett's esophagus, as we have discussed in detail. Two are the genetic mutations. First is the P16 gene mutation, and second is the RB or retinoblastoma gene mutation. These two genes are tumor suppressor genes. It means that these two genes are preventing the tumors from occurring. But when there is a mutation in these two genes, the tumor will going to arise, right? These both are tumor suppressors. When suppressors are not present, the activators will going to activate the tumors, retinoblastoma and P16 gene. Also, there is a very important thing here to remember that in case of adenocarcinoma, H. pylori. What is the function of H. pylori, or the what is the disadvantage of H. pylori in the GIT? It's going to affect the stomach. It will cause the gastritis, okay, gastric ulcers. But in case of adenocarcinoma, H. pylori have a protective role. Isn't it concerning that in case of adenocarcinoma, H. pylori have a protective role? It's very important here to remember. The gold standard for diagnosing esophageal cancers is nothing but biopsy. We have to cut part or cut a tissue from the esophagus, and we are going to examine it under the microscope, and we have to identify two things in that sample or that tissue. Is it squamous cell carcinoma or is it adenocarcinoma, right? So adenocarcinoma will going to tell us about some glandular appearance, like these glands are we are going to see under the histological appearance, right? These glands are seen. And in case of squamous cell carcinoma, we are going to see the keratin pearls. These are keratin pearls. These are hallmark for the squamous cell carcinoma, and they are very important in recognizing the squamous cell carcinoma and differentiate these two cancers. This was for today, and we have discussed about the Mallory Weiss Boerhaave syndrome. We have discussed about the Barrett's esophagus, the Plummer Vinson syndrome, esophageal tumors, squamous cell, and adenocarcinoma. So this was for today. I hope you understand this video, and I will see you in the next video. Till then, goodbye.